This is a comprehensive physical exam for occupational therapy. We go to the physical exam screen. We have the history of present illness, social history. We can use a quick pick, pain status, pain descriptors, type, precipitating factors, intensity level, control measures. We go to the pain medication, what it interferes with, whether the pain level is acceptable. We designate the acceptable and whether the physician has been notified. The system generates a paragraph from the quick pick. Now we go to the family history. We have communication style, family's ability to use rituals, caregivers development knowledge, caregivers anger management skills, and we can select the family history. Now we go to social history, psychosocial risk factors, lack of resources, history of social services involvement. Now we can look at surgical history. Now we're going into allergies and medications. In this case, we're going to add a new drug. MedSys2 has all 36,000 FDA drugs, every dosage, every drug is in the FDA database. In this case, we're using glucophage, 750 milligrams. We save it, and now it's in our medication profile, and it appears in the physical exam screen. We go to vitals. We select the patient's weight, height in inches. The system calculates the BMI. We put the blood pressure and pulse. Now we go to the comprehensive exam. We start off with durable medical equipment. We can select the equipment that's being used. In this case, it's cane grab bars. Now we go into the knowledge deficits, and this is under safety measures. We go to fall risks. Now we go into the range of motion, and we'll notice that we have fields that appear for the neck, back, shoulder, passive and active range of motion, including the strength. Now the physical exam range of motion fields for the OT exam are different than the range of motion for the PT. There is a separate module which has the range of motion module, which is used for the physical therapist, but here for the occupational therapist, because it primarily focuses on the upper extremities, it's included in the actual physical exam screen. So we go into the wrist, forearm, pronate, supinate, the fingers, flexion, extension, and the thumb, flexion and extension. We also have the manual muscle testing designations from 0 to 5. And you can enter either the numeric values, or you can type in the within normal limits. You hit the generate, and it actually generates the columns for the answers. Now here we're going into muscle tone and contractors. Now this is still under range of motion. We'll go to sensation, proprioception, light touch, deep touch, hot cold. We're now in the perceptual motor, vision, position in space, spatial relation, depth perception. Now we go into cognition, orientation, safety judgment, attention span, motivation, Memory retention follows commands. Now we go into coordination. Now this is gross motor and fine motor. Sitting balance, static and dynamic. Standing balance, static and dynamic. We go into the wheelchair assessment and whether the mobility is limited based on certain factors like strength, or now we'll go into the ADLs. We're in the transfer component. Okay, when we select, and the functional skills, now we have independent, some assistance, standby assistance, minimal assistance, moderate, maximum, unable to perform, not applicable. So we have in this area we have everything from toileting, cooking, light meal prep, eating, feeding, swallowing, food to mouth, light housekeeping, communication, ability to use the phone, transportation, medication management, and money management. Now we go into neurological. We're in the motor, fine motor, right and left, gross motor, right and left. Prior to injury, designation as far as hand preference. Neurological dysfunctions, sensation, proprioception. Now that we're into the cardiopulmonary areas, dyspnea when walking. Now we're into the edema, signs and symptoms including hypertension, heart murmurs, AFib. So we select the values, chest pain, whether it's appropriate. Now we can go into knowledge deficits. This is all under cardiopulmonary. When we're done with that, we can select a diagnosis. In this case, we're going to select cerebral vascular disease. We have all 86,000 ICD-10 codes, so we can do a quick search based on a brief description. Now we go into the plan. We're going to go ahead and do the quick pick on the interventions. Now the interventions are set up similar to the physical exam, where we start off with safety, pain, range of motion, wheelchair mobility, and these are the interventions or orders. The ADLs, neurological, and cardiopulmonary. So we select the items that are appropriate. Then we hit generate, and that generates our intervention or orders. Now we go to the goals: safety, pain, range of motion, wheelchair mobility. Again, same categories. We select the goals for each. ADLs, neurological, cardiopulmonary. When we're done, we hit generate. Now these generates our goals. Now we go to functional status. We look at homebound status. And we can actually also designate our rehab potential and our received orders for. Save that. That's our homebound status. Now we go into functional status. Now this functional status is similar to the one that we had in the physical exam component. It's a little bit more general. It does not have to be used, but we do include it. And that's our comprehensive physical, all the different areas. We save our answers. Now we generate the report. Now this generates a narrative report. There's our pain assessment, family history, social history. We didn't designate any allergies, but there's our glucophage for our current medication, our DME information, safety, range of motion, muscle tone and contracture, sensation, perceptual motor, coordination, our ADLs, our neurological exam, our cardiopulmonary status, signs and symptoms, our homebound status, and the second functional status. Now here comes the actual plans. Now they're designated by group. So we've got safety, range of motion, wheelchair mobility, ADLs. These are each of the interventions. Neurological, cardiopulmonary. Now we go into the goals. Range of motion, wheelchair, ADLs, cardiopulmonary, safety, pain, and then the signature. So that's our comprehensive report for the occupational therapist. For more information, go to our website, www.medsys2.com. Thank you.